One of the biggest things in my practice that I see is some patients want liposuction surgery and they may not be a candidate for it, and other patients think they want other surgical procedures and they're actually a better candidate for liposuction. It's really important to see and speak with a plastic surgeon so you can be evaluated prior to any surgical procedure. In my practice, one of the big things I see is patients may have a lot of extra skin or hanging skin, especially if the skin is damaged from the undersurface. Sometimes I tell them liposuction might not be the best option for them because after we perform liposuction and we empty out that space underneath the skin, they'll be left with extra loose hanging skin on top of it, which I don't think is a aesthetically pleasing look. I like to speak to patients one-on-one. I like to show them photos. I like to really give them realistic expectations so that we can together make the best informed decision for them. Some patients I'll see in my office and come to me and say that they want, for example, like a tummy tuck surgery, which is an abdominoplasty. And really, I like to evaluate them. I want to make sure that their core muscles either are together or they're separated. I like to evaluate their skin quality. Is the skin stretched out? Is it damaged? Or do they have really nice, firm, tight skin that I think can snap back after a liposuction procedure? And then I evaluate the fatty layer in between the muscle and the skin to see how much fatty tissue they have. Sometimes patients come and say they think the only option is a tummy tuck, and I'll tell them, what, your core muscles are really nice and tight. I don't think they're separated. Your skin quality is excellent. You just have that kind of stubborn fat in between the two, and undergoing a liposuction procedure is actually a better option for you, which is obviously a less invasive surgery than a tummy tuck. The difference between liposuction and an abdominoplasty, which is commonly known as a tummy tuck, is pretty great. They're two completely different surgeries. With liposuction, we're just making 2 to 3 small incisions, depending on the area that we're treating, and we're using a cannula to suction out the fat. We're not treating the skin, and we're not treating the underlying musculature. With a tummy tuck, what we're doing is we're making an incision, and we're kind of lifting all of that skin and fatty layer up. And really, one of the big components of a tummy tuck is repairing the muscle. So your muscles kind of here in the middle of your abdomen can sometimes get stretched out, especially commonly in women after pregnancy. And so it's very important to repair those muscles, and that gives you that nice flat waist. And then what we do is we re-drape all that skin and fatty tissue over that. There's usually an extra amount of skin and fatty tissue that we excise, and then we suture the wound together. So they're two completely different operations. They treat different parts of the anatomic abdominal wall. Like I said, liposuction is just treating the fatty layer, whereas a tummy tuck is treating the skin, the fat, and the muscle. And that's really important for patients to know. When I see patients and they may come to me and they think that the best surgical option for them is a tummy tuck, after I evaluate them, a better option is actually a less invasive option, which is liposuction. I will tell them that, and I'll tell them the expectations from the two different procedures. I'll tell them that they have really nice skin quality, their muscles are not separated, their core muscles, and they just have some fat kind of in between the two. And I'll tell them that liposuction is actually a great option for them. It's a quicker recovery, it's a less invasive surgery, but really it comes down to the surgeon and the patient creating expectations and making a decision together. One of the most common consults I'll see in my practice is patients who are unsure if they're candidates for liposuction or an abdominoplasty, which is commonly known as a tummy tuck. And really the best way to know which one is best for you is to see a trained plastic surgeon who can evaluate you in a consultation, do a physical exam of your skin, your abdominal area, and really give you their best recommendation of what they recommend for you. As far as the two surgeries, liposuction and an abdominoplasty are two completely different operations with different expectations and different recovery. In liposuction, what we're doing is we're making very small entry point incisions for a cannula, and we're using a cannula to just suction out fatty tissue. But really kind of determines who's a candidate for liposuction is you need a good core underneath that fatty layer. So you need your muscles to be nice and tight, and you need your skin quality to be pretty good. Because if your skin is damaged or kind of stretched out or hanging over, just doing liposuction will actually potentially make that skin hang look even worse, which is not ideal. As far as a tummy tuck, which is known as an abdominoplasty, there's really 3 components to the operation. One is we're treating the skin. Number 2, we're treating the fatty layer underneath the skin. And number 3 is we're treating the core abdominal muscles underneath the fatty layer. So patients who typically will present for a tummy tuck are females who have had multiple pregnancies and kind of their core muscles, their abdominal muscles are stretched out and separated. And what that does is it creates an appearance of a widened waist. So what we do is we make an incision that we hide very low in the bikini line so that nobody can see it. And we raise all that extra skin and fat on top of the abdominal wall, and we isolate those separated muscles. And then what we do is we repair those muscles, suture them together, make them tight. That kind of flattens the abdominal wall and really brings in the waist to create that hourglass figure. And then we re-drape all that extra skin and fat, and we excise whatever is extra, and then we suture the wound back together. And again, we really focus on keeping that incision very, very low and try to keep that scar as thin as possible.